The 3 itchy spots on elderly people indicate a shortened lifespan. If you don't have any of these, living to 100 is no problem. Health and longevity are pursuits for everyone. When it comes to longevity, our first thought is often about genetic inheritance. However, research has found that the biggest factor influencing longevity is people's lifestyle habits. Sometimes seemingly conspicuous characteristics may actually be signals of diseases that can affect lifespan. If an elderly person experiences itching in these areas after the age of 60, it's a warning from the heavens that their lifespan is short. It's crucial to pay attention. You may already know that the presence of itchy spots on elderly individuals can serve as an ominous sign, indicating a potentially shortened lifespan. These warning signs should not be taken lightly, especially since health and longevity are aspirations that most people share. Consider John, a 65-year-old retired teacher, who started experiencing persistent itching in his armpits. At first, John dismissed it as a minor irritation, perhaps due to dry skin or an allergic reaction. As weeks turned into months, the itching became more intense, despite his use of over-the-counter lotions and creams. His daughter, noticing not only the persistent itching but also significant weight loss, urged him to see a doctor for a thorough checkup. Upon visiting the hospital, John underwent a series of tests. The results were shocking. John was diagnosed with diabetes. The high blood sugar levels associated with diabetes had disrupted the function of his skin nerves and the autonomic nervous system, leading to decreased sweat and sebum secretion, dry skin, and persistent itching. This diagnosis was a wake-up call for John, emphasizing the importance of not ignoring persistent, unexplained itching. When we contemplate longevity, our thoughts often drift toward genetic inheritance. However, recent research has highlighted that lifestyle habits play a more significant role in determining one's lifespan. In fact, certain characteristics, which may seem innocuous at first, can actually signal underlying diseases that may affect longevity. For those over 60, experiencing itching in specific areas is particularly concerning and warrants immediate attention. In another instance, Emily, a 60-year-old woman, began experiencing continuous itching in September. Initially, she didn't think much of it, attributing it to seasonal changes. However, as winter approached, the itching became more severe. Despite her efforts to manage it with body lotion and ointments, nothing seemed to alleviate the discomfort. Additionally, Emily noticed she was losing weight. Concerned, she decided to seek medical advice. Emily's visit to the hospital revealed a surprising and alarming diagnosis: lymphoma. The persistent itching she had been experiencing for months was a symptom of this type of cancer. Lymphocytes, which are widely distributed throughout the body, can develop into lymphoma in any part of the body except for hair and nails. This case underscores the critical point that itchy skin can be a sign of serious underlying conditions, such as cancer. Lymphoma occurs when malignant lymphocytes produce biologically active substances like histamine. These substances are carried to the skin through the bloodstream, continuously stimulating the sensory nerve endings in the skin, resulting in itching. Approximately 20% of lymphoma patients experience varying degrees of skin itching symptoms. Therefore, persistent, unexplained itching that does not respond to treatment should be taken seriously and investigated further. Persistent itching can also indicate other serious health issues. For instance, itching around the anus can be symptomatic of anal or rectal diseases such as hemorrhoids, anal fistulas, rectal cancer, or anal cancer. Roughly 75% of patients with anal and rectal diseases experience anal itching, which starts mildly but can intensify and spread if left untreated. John's brother Robert, a 70-year-old retired engineer, began experiencing severe itching around his genital area. Initially, Robert thought it was a minor infection or irritation. However, as the itching persisted and began to interfere with his daily activities, he sought medical consultation. The diagnosis revealed that Robert had a gynecological disease causing the itching. Specifically, it was vulvitis, resulting from an imbalance of vaginal flora, leading to the proliferation of harmful bacteria. The genital area is particularly sensitive, and itchy genitals are more common in women, often caused by conditions such as vaginitis, vulvitis, eczema, genital warts, and scabies. These conditions can cause significant discomfort and are often accompanied by other symptoms such as pain, burning sensations, and exacerbation during urination or defecation. Prompt medical attention is essential to diagnose and treat the underlying cause effectively. Another common area for persistent itching in the elderly is the lower legs. Itchy skin on the lower legs can be related to hypothyroidism. When thyroid hormone secretion decreases and the metabolic rate slows down, the skin becomes dehydrated and dry, leading to itching. The lower legs have the fewest sebaceous and sweat glands, making them more sensitive and prone to itching, especially in dry autumn and winter seasons. Dry itching indicates aging, while damp itching often signals illness. Dr. Wang, the deputy chief physician of the dermatology department at Wangjing Hospital, pointed out that different types of itching require different approaches. Dry itching, common in the elderly, is mainly manifested as dry and rough skin with peeling. As people age, the secretion of sweat and sebaceous glands decreases, and exposure to dry weather or dehydration can cause the skin to itch. Damp itching, on the other hand, is frequently associated with diseases such as abnormal liver and kidney function, high blood sugar, and dampness in the perineum and anus. Liver and kidney dysfunction can lead to the accumulation of toxic substances in the body, resulting in poor skin condition, darkening of the skin, and persistent itching. Besides itching, these conditions can cause skin discoloration, roughness, swelling, and even secondary infections like folliculitis and lymphangitis. While scratching may provide temporary relief from itching, it does not address the underlying cause. Repeated scratching can damage the skin, resulting in redness, roughness, raised areas, and even secondary infections. These conditions can leave scars and further complicate the skin's health. Therefore, it is crucial to make changes in daily behavior and lifestyle to effectively alleviate itching. To prevent dry skin itching, especially in the dry season of autumn and winter, a proactive approach is necessary. Attention to dietary regulation is vital, reducing the intake of high-fat, high-sugar, spicy and stimulating foods, and consuming more foods rich in manganese and vitamins. Proper skin care and ensuring adequate sleep are also essential measures. While skin itching might seem like a minor inconvenience, it can be a significant indicator of underlying health issues, especially in the elderly. Persistent itching in specific areas, such as the armpits, anus, genitals, and lower legs, should not be ignored. Prompt medical attention and lifestyle changes can help diagnose and treat the root cause, ultimately improving health and longevity. Therefore, it is vital to be vigilant and seek medical advice if prolonged itching occurs. Your health and longevity depend on it. Research has shown that when lymphoma occurs, malignant lymphocytes produce biologically active substances like histamine. These substances are carried to the skin through the bloodstream, constantly stimulating the sensory nerve endings in the skin, causing itching. About 20% of lymphoma patients experience varying degrees of skin itching symptoms. Therefore, if unexplained itching persists and medications are ineffective, one should be alert to the possibility of lymphoma. In addition to itchy skin, lymphoma can also cause symptoms such as persistent lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, and anemia. It's important to pay attention to these symptoms. Itching is a common sensation that everyone experiences at some point. Typically, it's a minor annoyance that can be attributed to dry skin, insect bites, or allergies. However, when the itching is persistent and doesn't respond to usual treatments, it may indicate a more serious underlying condition. In the case of lymphoma, the itching is due to the malignant lymphocytes releasing histamine and other substances into the bloodstream, which then act on the skin's sensory nerve endings. What distinguishes lymphoma-related itching from regular itching is its persistence and resistance to standard treatments. Unlike common itching that may be relieved with moisturizers, antihistamines, or other medications, lymphoma-related itching remains stubbornly unaffected by these interventions. This type of itching is often described as intense and relentless, significantly impacting the patient's quality of life. Furthermore, the itching associated with lymphoma doesn't present with visible skin changes such as rashes or eczema. The skin typically appears normal, without the redness or bumps that usually accompany other types of itching. This lack of external symptoms can make it more challenging to diagnose and often leads to delays in seeking medical advice, as the individual may not realize the severity of their condition. Another characteristic of lymphoma-related itching is its sudden onset. It can appear without any preceding warning signs, catching the individual off guard. This sudden appearance is another red flag that differentiates it from the more gradual development of itching caused by less serious conditions. If such itching appears suddenly and persists, it warrants a prompt medical evaluation. Additionally, lymphoma-related itching is not significantly affected by weather changes. While many skin conditions may worsen or improve with changes in temperature or humidity, the itching caused by lymphoma remains constant. This persistent nature, regardless of external conditions, is another indicator that the itching may be due to a serious internal cause. If you experience persistent itching that does not respond to treatment, along with other symptoms such as lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss, or anemia, it is crucial to seek medical attention. These symptoms, when present together, can point towards lymphoma, and early detection is key to effective treatment. Delays in diagnosis can lead to progression of the disease and reduced treatment options. Lymph node enlargement is one of the more visible and palpable symptoms of lymphoma. Lymph nodes may become swollen and firm, often in the neck, armpits, or groin. This swelling is usually painless, which is why it can go unnoticed or be disregarded. However, any persistent lymph node enlargement should be evaluated by a healthcare professional to rule out lymphoma or other serious conditions. Low-grade fever, another symptom of lymphoma, often goes unnoticed or is attributed to minor infections or illnesses. However, when a low-grade fever persists over a long period without an obvious cause, it should raise concern. This persistent fever is the body's response to the presence of malignant cells and requires medical evaluation. Night sweats are also common in lymphoma patients. These sweats are often drenching and can disrupt sleep, leaving the individual feeling exhausted. While night sweats can be associated with various conditions, when they occur along with other symptoms like itching and lymph node enlargement, they become significant indicators of lymphoma. Unexplained pain can also be a symptom of lymphoma. This pain may occur in the lymph nodes or other areas of the body and does not have a clear cause. If you experience persistent pain without an apparent reason, it's important to seek medical advice to determine the underlying cause. Weight loss and anemia are additional symptoms that can occur with lymphoma. Unexplained weight loss, especially when it is rapid and not due to changes in diet or exercise, can be a sign of a serious condition like lymphoma. Anemia, characterized by fatigue and weakness, can result from the body's inability to produce enough healthy red blood cells, often due to the presence of malignant cells in the bone marrow. Given the seriousness of lymphoma, it is vital to be vigilant about these symptoms. Early detection significantly improves the chances of successful treatment. If you notice any combination of these symptoms, particularly persistent itching that does not respond to standard treatments, seek medical advice promptly. Then, itching is a common and often benign symptom. Persistent itching that resists treatment can be a sign of lymphoma. This type of itching is usually intense, appears suddenly, and is not accompanied by visible skin changes. Along with other symptoms such as lymph node enlargement, low-grade fever, night sweats, unexplained pain, weight loss and anemia, it serves as a warning sign that should not be ignored. Early medical intervention is crucial for a better prognosis in lymphoma patients. Persistent skin irritation can often be overlooked as a benign issue, but it can sometimes signal underlying health problems. When a certain area of the skin feels persistently irritated, especially if it is not relieved by standard treatments, it's important to investigate further. This discomfort can manifest in various parts of the body and might indicate specific medical conditions that require attention. Understanding the implications of persistent skin irritation in different body areas is crucial for early detection and treatment of potential health issues. For instance, the armpits are one area where persistent irritation might indicate a condition such as diabetes. High blood sugar levels can disrupt the function of skin nerves and the autonomic nervous system, leading to decreased secretion of sweat and sebum. This results in dry skin, which can become persistently irritated. Additionally, individuals with diabetes, especially those who are obese, may experience increased sweating in the armpits. This creates an environment conducive to bacterial and fungal growth, further exacerbating the irritation. Typically, skin discomfort associated with diabetes does not present with visible red patches or bumps, but may be accompanied by a sense of hidden discomfort that can spread to other body parts. Another area where persistent discomfort warrants special attention is around the anus. Anal irritation can stem from a variety of causes, most notably anal and rectal diseases. A significant percentage of individuals with conditions such as hemorrhoids, anal fistulas, rectal cancer, and anal cancer report experiencing anal irritation. Initially, this irritation might be mild and localized, but without proper treatment, it can intensify, spread, and become a regular nuisance, particularly at night. This significantly disrupts normal life and requires medical intervention to address the underlying cause. In the genital region, particularly for women, persistent irritation often indicates gynecological issues. Conditions such as vaginitis, vulvitis, eczema, genital warts, and scabies are common culprits. For example, vulvitis can lead to discomfort due to an imbalance in vaginal flora, allowing harmful or pathogenic bacteria to proliferate and disrupt the vaginal environment. This type of irritation might be accompanied by pain or a burning sensation, particularly during urination or defecation, and can worsen with scratching, creating a vicious cycle that needs medical attention. Discomfort in the lower legs can be indicative of hypothyroidism. When the thyroid hormone levels drop, the metabolic rate slows down, leading to dehydration and dry skin. The lower legs, having fewer sebaceous and sweat glands, are particularly susceptible to becoming dry and irritated. This condition is often more severe during the dry autumn and winter seasons, characterized by a tingling sensation, scaliness, and a pale, cold appearance of the skin. Identifying this type of irritation can lead to early diagnosis and management of hypothyroidism. It is crucial to pay attention to areas of persistent skin irritation, as they can be early indicators of systemic health issues. In many cases, these symptoms are the body's way of signaling that something is amiss internally. Ignoring these signs or simply treating them with over-the-counter remedies without investigating further can delay diagnosis and treatment of potentially serious conditions. Therefore, it is vital to consult healthcare professionals when experiencing unexplained and persistent skin discomfort in specific areas. Moreover, understanding the broader context of skin irritation can help in distinguishing between benign causes and those requiring medical intervention. For example, while common skin irritations might be due to environmental factors or minor infections, persistent and unexplained discomfort is often more serious. Recognizing the patterns and associated symptoms, such as the seasonal nature of diabetes-related skin issues or the nighttime intensification of anal irritation, can provide valuable clues. Healthcare providers often use a combination of clinical evaluation, patient history, and diagnostic tests to determine the underlying causes of persistent skin irritation. Blood tests can reveal issues like diabetes or hypothyroidism, while imaging studies might be necessary for diagnosing rectal or anal conditions. Biopsies can help identify cancers or other serious conditions affecting the skin or internal organs. Early detection through careful monitoring of skin irritation can significantly improve treatment outcomes. Educational initiatives and public awareness campaigns are essential in helping individuals understand the significance of persistent skin irritation. By spreading knowledge about the potential health implications of chronic skin discomfort, these initiatives encourage people to seek timely medical advice. Such awareness can lead to early diagnosis and better management of conditions like diabetes, hypothyroidism, and various cancers, ultimately improving quality of life and health outcomes. In general, persistent skin irritation should not be dismissed as a minor inconvenience. It can be a symptom of various underlying health conditions, from diabetes and hypothyroidism to gynecological and anal diseases. Recognizing and understanding the specific patterns and associated symptoms of skin irritation in different body areas can lead to early detection and effective treatment. Consulting healthcare professionals for persistent and unexplained skin discomfort is crucial for maintaining overall health and well-being. Alright, let's dive into this topic as if we were having a chat. You know, itching is one of those things that everyone experiences, but not all itching is the same. There's dry itching and damp itching, and each has its own story to tell. Now, imagine you're chatting with Dr. Smith from hospital. He's a top-notch expert in dermatology. He says that when your skin itches because it's dry, it often means you're dealing with the natural effects of aging. Think about it. As we get older, our bodies don't produce as much sweat or oil. These are the natural moisturizers for our skin. Without enough of them, our skin starts to dry out. It gets rough, maybe even a little flaky, and that's when the itching kicks in. It's like the skin is saying, "Hey, I need some moisture here." Dry weather or not drinking enough water can make things worse. If the air around you is dry, or if you're not keeping yourself hydrated, your skin loses more moisture. It becomes parched, kind of like how your mouth feels when you've gone too long without a drink. That dryness leads to itching, and it's a common complaint, especially among older folks. Their skin is already naturally drier due to less oil production, so they're more susceptible to this kind of itching. Now, let's switch gears to damp itching. This is a whole different beast. Dr. Smith explains that damp itching is often tied to various health issues. For example, if your liver or kidneys aren't working properly, you might start to notice your skin acting up. These organs are your body's detox powerhouses. They filter out all the bad stuff. When they're not functioning well, toxins can build up in your body. This buildup doesn't just stay inside, it affects your skin too. You might see changes in skin color, rough patches, or swelling, and yes, itching. The skin can darken or become uneven, which isn't just uncomfortable, it's also a sign that something deeper is going on. Kidney problems can lead to similar issues. The kidneys help get rid of waste and excess fluids. When they're not up to the job, these wastes hang around longer than they should. This can make your skin itchy and irritated. People with high blood sugar, like those with diabetes, often deal with this too. High glucose levels can change the texture and moisture levels of your skin, making it more prone to itching and infections. Dampness in particular areas, like the perineum and anus, can also cause serious itching. These areas can get damp from sweat or other body fluids, and if they stay moist, it's a breeding ground for irritation and itching. It's especially uncomfortable and can lead to bigger problems if it's not taken care of properly. So, what do you do if you're dealing with dry itching? First off, keeping your skin hydrated is key. Use moisturizers regularly, drink plenty of water, and try to avoid long hot showers because they can strip your skin of its natural oils. Gentle skincare products are your best friends here, nothing too harsh or irritating. And if the weather's dry, a humidifier can help keep the air, and your skin, from drying out too much. On the flip side, tackling damp itching means addressing those underlying health issues first. Regular checkups to keep an eye on your liver and kidney function are crucial. If you have diabetes, keeping your blood sugar levels in check is essential to prevent skin issues. And good hygiene, especially in those moisture-prone areas, is non-negotiable. Using powders or other products that keep those areas dry can make a big difference. If the itching is really bad, sometimes you need a bit more help. Medications like antihistamines can help reduce the itch by blocking histamine, which is what your body produces when you have an allergic reaction. Topical creams, like corticosteroids, can also be helpful to reduce inflammation and relieve itching. But you should definitely talk to a doctor before starting any medication. In a nutshell, understanding why you're itching is half the battle. If it's dry itching, it's usually about keeping your skin hydrated and protected. If it's damp itching, it's more about tackling the health issues that are causing it and keeping good hygiene. Dr. Wong's advice is invaluable here. Distinguishing between these two types of itching and taking the right steps can really improve your quality of life and keep further problems at bay. So next time your skin feels itchy, take a moment to think about what your body might be telling you and take action accordingly. You know, scratching might seem like the most straightforward way to deal with that nagging itch, but it's far from a solution. Sure, it provides temporary relief, but it doesn't address the root of the problem. Instead, scratching often makes things worse. After scratching the same spot over and over, your skin can become irritated and damaged. This irritation can lead to redness, rough patches, and sometimes even raised, bumpy skin. In severe cases, you might notice pigmentation changes, areas of your skin turning darker or lighter. And let's not forget about the potential for bleeding or secondary infections like folliculitis, which is an infection of the hair follicles, or lymphangitis, an infection of the lymphatic vessels. The result? Scars that can be both physically and emotionally distressing. So, what can we do to manage that relentless itching? It starts with making some changes in our daily lives. When it comes to itching, there's a noticeable difference between damp and dry itching. Dry itching is particularly common, especially during the autumn and winter months. It's not just the elderly who suffer from dry skin. Young people can also experience this if they neglect proper skincare. The dry air saps moisture from the skin, leading to that all-too-familiar itchiness. One of the first steps to combat this is dietary regulation. What we eat plays a significant role in the health of our skin. High fat, high sugar, spicy, and raw or cold foods can exacerbate itching. Instead, our diet should include foods rich in manganese, like radishes, cabbage, and sweet potatoes, as well as those packed with vitamins, such as animal liver, carrots, potatoes, and mushrooms. These nutrients help maintain healthy skin and can reduce the likelihood of itching. Equally important is our skincare routine. Ensuring our skin remains well moisturized is crucial. During the dry seasons, we should reduce the frequency of our baths or showers and avoid hot water, which can strip the skin of its natural oils. After bathing, applying a good moisturizer helps lock in moisture, keeping our skin hydrated and less prone to itching. Our sleeping habits also play a role. Adequate sleep is essential for overall health, including skin health. Poor sleep can exacerbate stress, which in turn can worsen itching. So maintaining a regular sleep schedule and creating a relaxing bedtime routine can be beneficial. Of course, scratching should be avoided as much as possible. It's easier said than done, but finding alternative ways to soothe the itch, like applying a cold compress or using over-the-counter anti-itch creams, can help. In addition to these measures, it's important to consider our living environment. Dry air from heating systems in the winter can exacerbate skin dryness. Using a humidifier can help maintain moisture in the air, reducing the dryness of the skin. Identifying and avoiding triggers is also key. Everyone's skin is different, and what causes itching for one person might not affect another. Common triggers include certain fabrics, soaps, detergents, and even stress. Paying attention to when and where your itching occurs can help you pinpoint the causes and make necessary changes. Remember, preventing itching isn't just about what we do externally, it's also about internal health. Staying hydrated by drinking plenty of water keeps our skin supple and less prone to dryness. Additionally, reducing stress through activities like meditation, yoga, or even simple breathing exercises can help keep itching at bay. It's also worth noting that sometimes, itching can be a symptom of an underlying health condition. If you find that your itching persists despite making lifestyle changes, it might be time to consult a healthcare professional. Conditions like eczema, psoriasis, or even more serious issues like liver or kidney disease can cause chronic itching. It's not a sustainable solution and can lead to more severe skin problems. By making changes to our diet, skincare routine, sleeping habits, and living environment, we can effectively manage and prevent itching. And of course, if itching persists, seeking medical advice is always a wise step. Taking a holistic approach to skin health not only alleviates itching, but also enhances overall well-being. In general, although skin itching is not a disease but a symptom, it can reflect the skin condition and overall health status of the body. Persistent itching may indicate underlying health issues that require attention. For example, conditions like eczema, psoriasis, and allergic reactions often present with itching as a primary symptom. Moreover, systemic diseases such as liver disease, kidney failure, and certain cancers can manifest through prolonged skin itching, making it essential to recognize and address the symptoms seriously. Ignoring persistent itching can lead to more severe health problems. Scratching the itch can cause skin damage, infections, and scarring, exacerbating the underlying issue. Additionally, the constant discomfort can affect one's quality of life, leading to sleep disturbances, anxiety, and depression. Understanding the potential causes of skin itching and taking appropriate measures can prevent these complications and promote overall well-being. Therefore, when prolonged itching occurs, it is crucial to be vigilant and seek medical attention promptly. Early diagnosis can make a significant difference in treatment outcomes. A healthcare professional can help identify the root cause of the itching and recommend appropriate treatments, whether they involve topical medications, lifestyle changes, or further diagnostic tests. Addressing skin itching at its onset can lead to more effective management and relief. That's all for this video. Thank you for watching and participating. If you found this content helpful, please give it a thumbs up, subscribe to our channel, or share it with your friends by clicking the button in the bottom right corner. Your support is my greatest motivation. See you in the next video.